All right, guys, we're going to talk about oxygenation. And the information from this was taken from the Advanced Techniques in Adult Critical Care, the Open Lung Tool PowerPoint, and the review of adult mechanical ventilation. So when we're talking about oxygenation, this is our main point here. So let's say here in the middle. So let's talk about some of the ways that you can manipulate your oxygenation and mechanical ventilation. So we go up here. So here's some other settings, right? So some other settings to help that could be to increase your FiO2. You could decrease your flow because it's going to give you a longer I time, which will ultimately increase your inspiratory time. So that'll help to oxygenate the patient better because it's going to give them a bigger mean airway pressure. So one of the biggest aspects to oxygenation, as you guys are well aware, is PEEP. So PEEP's up here, and it's got a lot of different aspects to that. Let's look at some of this here. So what is PEEP? PEEP it prevents alveolar collapse at end exhalation, which increases perfusion. So as we talked about the other day, let's look at the optimal PEEP. So some ways to use that is to use recruitment and de-recruitment maneuvers. So when you're doing an optimal PEEP study, if you look here, you're going to want to monitor any adverse effects that you may have. So when you make a change, you're always going to want to look at the blood pressure first, because as we know, as you increase your PEEP, you're increasing your intrathoracic pressure, which has a direct effect on cardiac output. So always look at your blood pressure first. After that, you're always going to monitor your tidal volumes, your CO2, and your compliance to make sure that you're below the 25. And here's just another aspect that I was just saying. So if you raise your PEEP, it's going to be natural that your PIP is also going to increase because you're naturally increasing the pressure in the chest. So you will see a rise in your PIP as well. So when you're making your changes with PEEP, you're going to want to increase those by 3 to 5 with changes. And then you're going to want to remember to look at the blood pressure first and then monitor these other aspects. So with PEEP, this is your normal. Normal's 3 to 5. And then up here, of course, you're going to want to increase your PEEP when your FiO2 is at 60% or greater. So if we look down here at the measurements of oxygen, these are the best measurements to look at when you're looking at your oxygenation. The biggest one is the PaO2 to FiO2. So your normal's 350. If it's less than 300, that's an acute lung injury. And if it's below 200, that's ARDS. And then over here is some different positioning techniques that you can try for best oxygenation. You can try proning your patient. It's not exactly understood how this works or why it works. It could just be because of positioning and gravity. It helps increase the functional residual capacity. The other aspect to this is if there's one side of your patient that's worse, so if the right side is worse than the left, then you can put your, you're going to want to put their good side facing down. So if it's their left side that's good, you're going to turn them on their left side with their bad side, which would be the right side in this case, up. And so that'll help to recruit as well. So that is it for the oxygenation mind map.